Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into this latest video. So, for a patient who attended with bilateral, fully occluding, really hard, dark earwax, we're in the right ear at the moment. This is the patient's worst ear, and in this ear, the patient is also experiencing otalgia. And as we remove the wax at the end of the procedure, you'll see why. There's a bit of a swelling, bruising on the posterior canal wall where the wax was in contact with, which is obviously caused a bit of soreness, tenderness for the patient. Now, this more lateral piece of earwax near the entrance was a bit gooey and soft, a bit glutinous. I managed to remove that pretty straightforwardly. However, the remaining wax, this wax I'm trying to remove now, it was lodged deep in the ear. So the patient has got quite a narrow ear and quite a bendy ear. And the earwax itself, it's very, you'll see it once we get it out, it's very hard in texture. It's very abrasive, so the surface is very rough. You can almost strike a match on it. And we just have to be really gentle with the patient removing this, because as soon as I place a suction probe onto the wax, it applies some pressure, and the patient could feel this, especially at the base here. You can see you can see some dead skin that's adhered to the underlayer of this plug of hard, dry wax. And as I'm wriggling this forward, it's trying to detach itself from the skin. And the skin itself is then trying to attach itself from the base of the ear canal wall. And I think I'm going to use an ear hook in a moment to see if I can prise this out. So I've just got a suction grip here at the bottom. I'm just wriggling it slightly. And the idea of wriggling it is just to loosen it from the canal wall. And if it's lodged behind the second bend, which it is, just to manoeuvre it forwards. But it's just too rough a piece, too hard a piece to come out. So I'm just going to insert an ear hook, I think. Yes, there we are. Just at the roof of the ear canal. I'm trying to embed the hook in the core of the wax. However, it sliced it in half. It dissected it as opposed to extracted it. So I've just installed some olive oil earwax drops. And whilst it's in the ear, I've developed this new technique where previously I used to put the olive oil drops into the ear for a few minutes, ask the patient to drain the ear. So we tilt the patient's head the opposite way with the tissue underneath to collect all the oil that's drizzling out the ear. But more and more now, I'm actually instilling the drops into the ear, having the patient's head tilted so the ear that, obviously this is the patient's right ear, so it's facing the ceiling, and at the same time, whilst the drops is within the ear, suctioning it out. So it can be a bit more difficult because we can get a bit more blaring, but I've kind of almost learned how to control that as well. To a point, it's not always possible to do this. And I just find, whilst you suction and the oil's in the ear, you just get better results. You get better lubrication. So a plug of wax like this is more likely to kind of wriggle itself out as you suction. And again, on the left-hand side, you can see all that dead keratin. So this keratin is acting like double-sided sticky tape. Not only is it attached itself to the canal wall, it's also attached itself to the underneath of the plug of wax. And this is why I think an endoscope is so beneficial, because with an endoscope, I've got the whole field of view. And it's enabled me to manipulate this plug of wax upwards. I'm anchoring it upwards, which has kind of loosened it and detached it from the isthmus, which is a narrowing really deep in the ear near the eardrum. And by tilting the wax upwards, I've managed to free it. And if I didn't have an endoscopic view, I may not have been able to do that. So just some residual soft dark wax, really deep medially beyond the isthmus. You can just see the isthmus there. So where this wax is, this is where the ear canal narrows slightly and it protrudes back outwards again. Now, to the left here, it's a bit tender. And you can see there's some skin all the way around this tenderness. So I'm trying to peel, but it wasn't going to peel off because it's too stubborn, it's too tightly adhered. And it's just, I think the patient's just got slightly inflamed, probably a bit of benign osteotitis here. So the bone here at the base, it's just become slightly tender. And the skin that's lining it, it's slightly inflamed. And this is just dead skin around this tender area, tender spot. So we've got to be really careful. We don't want to try to touch this tender area. So I've just come to the front of this tender region in the ear, because you've got some dead skin here, and I've just peeled a bit away. But so this bone is slightly inflamed. I suspect the patient's got benign osteotitis. And it's most likely occurred because the patient's wax was really rough. It was tightly impacted in the ear. That should settle down. Lovely healthy eardrum. Onto the left ear, I put some olive oil drops in straight away, and I've just opened up the ear canal entrance, so the posterior lateral concha cartilage. I've just used the suction probe to stretch it to the right, just to manoeuvre it open. I've now got a suction grip, and I'm slowly but surely bringing it forwards and out of the ear. And the wax has obviously been there for a while, you can tell by the colour. The patient has to have their ears cleaned probably every couple of years, I think they mentioned. In the first time they came to see myself, previously they would go to their local GP and have it syringed. So it was like a controlled water pump to flush the wax out. They found the whole process very uncomfortable. So they got recommended to see myself by a friend of theirs who came last week, and you can see that came out quite easily. A bit of dead skin at the base. You can see the colour of this ear canal is it's not as red as the other one, so the wax was really impacted in the right ear, whereas this one, it wasn't as impacted. Just some dead keratin at the top, just using a fine end gauge, just going to loosen this dead skin. And in a moment, you'll see a close-up of all the wax plugs. I actually used the endoscope to record it, so you can get a really high-definition view of them. Just going to mop up some of this oil from the entrance as well. So again, lovely healthy eardrum. Got a light reflex there, which is a good indicator that the patient's eardrum's healthy. There we are, just mopping it up. And in a moment, you're going to see some close-up shots of the wax with an endoscope. Just see how dark it is in colour. Well, I hope you enjoyed that video, guys, and you're keeping well and safe. Stay tuned, and I shall upload some more videos in due course. Have a great evening. Take care.